Hi everyone, hi, Christine Crowell again. Today I did a video about AI and the future, and I did a live, and I just wanted to follow on from that because I think it's important that we really look at this as how we're going to progress in our healthcare business and how these AI introductions into healthcare industry, because it's here. It's not like it's not here, it is here. Have you implemented that into your business? Have you started looking at that? Have you put it into your business plan as, a form of that you're going to be using AI? And what type of AI tools are you using? Are you using it for your, for example, your teams? Is it 365 AI, for example? Is it Chat GPT, for example? What is the handbook that you've got for your staff members? Does it include AI and the use of AI? And is it something that you've started to implement into your systems, your policies and procedures? Have you sat down with your team members, for example, your managers, and just sat down and said, look, AI 2025, we've got to start implementing it in healthcare. The NHS are using it, for example, if you're in the UK, if you're in America, then you've got the HIPAA that you're dealing with. In the UK, it's the GDPR. So what does your GDPR policy say about AI? And also, if you are using remote teams, what is the AI policy for your remote teams, for example? If you're looking at using remote teams, then you then need to look at what um, assets in terms of software that they're using, which belongs to you, for example, but have access to a certain level according to the position. You don't give them all access to everything. And also another thing that you need to think about is that you send your own laptops over to your remote workers so that they use your company's laptop, and that things, if anything gets downloaded, which really it should be just on the drive, on your OneDrive, your company's OneDrive, that things get downloaded to there, for example. And then also to look at when you're having meetings and you're doing your weekly meetings or daily meetings or whatever, if the if the team are meeting with clients, for example, that they are recording with the client's permission, of course, that you're recording the session, and that the client then also gets the notes, which the AI will summarize it and then send it. But you need to start implementing your AI policies and think about things that you need to be implementing is your staff handbook, your client guide, for example. You're using AI, so they need to be informed as well, and what you're using it for and how it will be used, and what your procedures are for safety and security, so that people's information will be safe and not be misused and treated in the way it's not meant to be treated. If you've got remote workers, they must respect that. Otherwise, they're not being ethical. Okay? So you've got to make sure that they've got the agreement and that they've signed the agreement, and that you also have got what you would possibly look at doing is, when you're looking at remote teams, you arrange for a company that you know and trust to go out and visit that person in their environment and implement, or even do remote. They can do it remotely, for example, but implement making sure that they use the VPN that you've arrange for them to use, not going off that VPN, and that laptop is locked to that VPN that you have arranged for it to be on, and the staff must use that laptop with that VPN, which is your VPN, and it connects to your system, your server, so that you know what's happening in your business at all times. Now, if a staff member was to turn around and say, oh, I've got an issue with the laptop, can I use another laptop? Then you're going to have to say, no, you can't work today. If it's not working, we need to sort that out and deal with that. Keep it all on the same platform. Keep your laptop for your company, so it's being used purely just for your company. And also the VPN is being used with your company server, so that you can go in at any time and see what is happening, for example. That is how I would say to you to use, when you're using AI, as well as your safety protocol, security protocol, that is how you keep your company's information safe. As well as you got your GDPR, your HIPAA compliant, you're registered with the relevant organization to show that you are compliant, so that your remote workers will work in compliance with your organization. And that's why, for me, it's important to use healthcare professionals that we have as virtual assistants, that are nurses, for example, because they will understand the seriousness of not complying. And they will comply, because usually they do. I don't think I've ever met a nurse that's not complied, because they're used to compliance. They're used to being ethical. They're used to being adhering to policies. They take it seriously, and they listen as well. So when you're looking at remote teams, look at whether you're using a virtual assistant or whether you're using an apprentice. If the apprentice is working remotely, then you got to give them a laptop. It's got to be on your VPN, not their VPN, because anyone can access that VPN. For example, it has to be security for you and your organization. But like I said, with AI, we got to look at what can we do that's AI related, that is going to help the business, but also help the staff members to become trained in AI usage. Because if you don't, you're going to get left behind. It's going to flip on you, and you'll get left behind. Then you're going to think, what's happened here? And all the other care providers, they've gone ahead of you, and they're using AI, and they're showing it in their policies and procedures. They're also showing it when they're applying for contracts, for example. They say what type of AI that they're using. For example, look, Microsoft, Google, everybody is using AI, and we've got to get with that. We really do. Otherwise, you're just going to get left behind. If you have got a job currently at the moment, you need to look at that job to see whether that job is going to need AI with it. Because what's going to happen is there are going to be some people that do lose their job. And you don't want to be one of those people that loses their job. So start looking at that job now to see what things are AI related that you can do, so that you're a valuable employee. Because what's going to happen is your company, because of the inflation and the cost of things, cost of living, everything is going up. So for companies, it's hard to keep everyone employed. And if there's AI that is offering a solution where it can do the job of, say, 5 people, for example, then guess what? What do you think that company is going to do? Of course, they're going to let some people go, but they'll keep the ones that know how to operate the AI. But it also depends on how big the corporation is. There could be a small organization, so maybe they may just need 1 or 2 staff on, and then the AI does the work of, say, 10 people, for example. So this is the flip side of AI, and the future is that some people are going to lose their job. But if you look at things that you're going to be valuable at, then it's hard for them to get rid of you, because they're going to want to keep you because you're such an amazing employee, and that you know AI, and then you can do all of the jobs that the company needs, for example. So it makes you more valuable, for example. Now, like I said, AI was created by humans. AI isn't going to take over humans. It's the humans that's going to take your jobs that know how to operate AI. Let me say that again. AI isn't going to replace humans. It's the humans that know how to operate AI will take your job. And that's the thing that you've got to think about. It's not the AI, it's what job is it that you have that you can get skills for AI, or even you may be in a position where the AI has taken your job, for example. So what is it, or the human that's operating the AI, should I say? So what is it that you can do right now? What skills can you learn right now that's going to make you irresistible to an employer, sorry. So they're going to want to keep you on, or you can get a job that's going to pay you higher, for example. Because if you can operate and learn how to operate AI, then that's going to open up more jobs for you, and even higher paid jobs, because you know about AI, and that you can input the data that's going to give the correct information that that company needs, for example. So this is where you're going to stand out from the others. I see that if we learn and embrace the AI and learn the new things that we need to learn in order to have the position in a job with using AI, then we're not going to be replaced. Well, you shouldn't be replaced, but it will be the humans that will replace your job, because they know how to operate the AI. So that's the thing that you need to think about, everyone. So directors, care providers, let's get you looking at the future now, and looking at what AI things can you implement in your company that's going to streamline your processes, do things a lot quicker, because it really does do things a lot quicker. I mean, I will be the first one to admit it, that it really has helped with me getting things done a lot quicker. You know, things that would take one person, for example, to type up my notes, for example, when I've had a meeting, 2, 3 days later, or even 5 days later, to get all the meeting notes, AI can send it within an hour. And that is a big savings for the company financially, for example. So yes, people their hours are being reduced. Some are, or have, or will lose their job. But what is it can you do? Because there's plenty of jobs out there that is to do with AI. So whether you're the employer, you can look at what AI tools can you introduce into your organization so that you can look at making a savings on paying staff wages. Then you can create that money that you save, 10, 15% can go to your crisis fund. You save that money monthly. I wish I'd done that many years ago, because when I got hit by the recession, there was nothing I could have done apart from that. And if I knew about that, I would have done that many, many years ago. I would have created a crisis fund so that when the recession hit me, I was still able to function instead of being in a panic and stressed and losing things, losing my business, you know, because of the recession. You know, I've been in 3 recessions in a business, but if I knew what I know today, you know, the money psychology side of things, then I could have prevented that from happening. But this is the future now, and I have to think of today. And this is why I'm advising you to create a crisis fund now. Get AI in and start implementing AI in, and then that way you can reduce some of your staff. I know it sounds terrible me saying this, but you can't let the whole ship go down, okay? Inflation's here. You want to beat inflation, so you've got to be strategic. I kept everybody, and that was the bad thing to do, you know. So look at what you can do with AI in your company. Look at the positions that you've got currently in your company that people are doing, and then look and see if this can be done by AI. And then that will be a savings for you. And then you can use that money to save, put it into a savings monthly, so that if and when a crisis hits you, you're in a strong position to not be in a stressful situation, for example. And then, you know, once you come to perhaps the end of the year, for example, then you can perhaps, you know, give yourself a bonus, for example, or even, you know, give the staff members a bonus, and then have yourself a little mini break. You deserve it. When you're running a healthcare business, it's no joke. It's not easy. People think it's easy. They see you as the care provider, see you as the director, thinking that, you know, you're sailing, but you're not. You're working all the time in your business. You don't switch off. So you should have some enjoyment too, because you went into this business for a reason, for freedom, family time, to help your family, to help loved ones, build a charity, whatever. You went into it for a reason. And remember that reason in 2025. Don't lose that reason. Don't lose that alignment of why you did it. Why did you go into business? That's the question. So I hope that you found that helpful today. And I just wanted to continue on from the live that I did today about you introducing AI into your business, which I know you've got it, but implement the policies. Like I said, write down what AI are you currently using in your business? What is it doing? And can you do a staff audit? Can you reduce your staff members and use AI? You know, we got to be real. Inflation is here. Cost of living has gone up. National insurance has gone up. Healthcare system is on its knees, and we need to have some crisis fund, because this is the reason why we're paying. The inflation is happening as well because of the budgets that have happened, it's all around the world. So let's look at what you can save as a business and create that crisis fund and save 10 to 15% of your monthly turnover and put it into your business bank account to pay for any, you know, crises or any unexpected expenses that you wasn't anticipating. So just think about that, directors. So I hope that was helpful for you. This is Christine Crowell here, signing off for now, and I will speak with you tomorrow. Have a good evening. Take care. Thank you. Bye.